It's been a few years since you started working for the practice, and you haven't had a raise since you started. You approach the office manager requesting one, only to be told that not only is the answer to your raise no, but now you're on probation. On this episode of RDH Coast to Coast, Tina and Kim discuss this listener-based scenario and share their thoughts on this event and what should come of it. So friends, grab your headphones and listen in as Tina and Kim share some advice for our listener who went on probation. Hey, Kim, I'm excited to chat with you this week about our episode topic. And I know for those of you that listen in, I'm coming at Kim blind, 100% hot. She has no idea what I'm about to ask her or talk about, because I had someone reach out to me, Kim, with a question, and I'm going to paraphrase this question down because it's a couple paragraphs long, what's going on. But as a hygienist she's been a practicing hygienist for, I want to say a couple decades, I think, but she said that she has been practicing at an office for about 3 years now. And she asked for a raise a few weeks ago, and she hadn't heard anything back from them. And then she asked the office manager again, and she said the officer manager said that none of her reviews from patients have come back very good. And so I'm going to put you with the doctor to be supervised, like really have the doctor come in and overlook your work. And they said that, so it says, I'm going to put you with a doctor for 90 days, and then we can have a decent review to see how much stuff you're leaving behind. And that the doctor says you're not leaving stuff behind on every single tooth. And she says that she's going through and she's disclosing solution, using air, that most of her patients really love her, but she's not getting a raise. And she really thinks that it's because the office wants her out, because she only wants to see patients once an hour instead of every 40 minutes. And she's like, what are your thoughts? Can you help me? So Kim, that's pretty big and loaded, right?
That is a lot to take in. So many different things.
So let's see. So first thing first is she asked for a raise and reviews are coming back not so great. And so they sent her with the doctor to have everything looked at. So what are your thoughts on that first aspect of it?
Okay, so she's asking for a raise. This is my first initial question. Right. Has she seen these reviews that have come back negative from patients? Is this the first time that she's hearing about this? Because if it's something that's happening regularly, why hasn't it been brought to her attention before the fact that she's asking for a raise, right?
Right. I know that's what my thought too. I was like, well, do you have more data behind this? And I was like, and probably like maybe there's a nugget of truth to this. So, what kinds of questions have you gone into? But yes, I agree. Like what are the reviews? And I guess she says it's, I think I said from the patients, but I guess it's mainly from the doctor that she works with. The reviews are not coming back great.
Okay. So again, we all went to hygiene school, right?
Yep.
We all passed our boards. We're all hygienists. Do we do a perfect job on every person? No, we do what we can in the time that we have given. Mm-hmm. It's funny that you said that, because I recently read on social media of a hygienist more in the new grad space, but she was just let go from her job because she's not removing enough calculus. So again, what are we doing to support hygienists that we feel are struggling in that area? Are you not telling the hygienist until she's asking for a raise that you're not doing a good job? Right. Or are you offering to say, hey, I see some calculus here on this tooth, and maybe getting them the support that they need to better reach or learn how to remove in those areas?
Right. Like, hey, there's some CE courses that I can see where there's some hands-on instrumentation. Why don't you take that? Or, can we bring a hygiene coach in to see about working through that? Yeah, for sure.
Yeah, absolutely. I'm kicking my dogs out of the room in case.
Yeah, that's,
but that's okay. But yeah, there's so many things. And I think that Um, Removing calculus is one aspect of our job. It's the mechanical aspect, but there's so much more that go into it. Do her patients love her? Is she bringing value to the team? And this is just one area of weakness that needs improvement, that they can offer her that improvement. And that's kind of the take that I got when I saw that new grad got let go from an office for that reason. It's maybe that means it's not the right office for you.
Right.
Too.
I agree. And, according to this individual, she says that her patients love her and she's developed a strong relationship with her. I want to back up for a second though, and I kind of play maybe devil's advocate. I don't know, but whose responsibility is it to take ownership of the skills progression for the hygienist? Should the office say, hey, if you want to stay here, you need to do this course. Now, who pays for it? Does the hygienist? Does the office? Where does that come into play? That, I think that's a whole other episode topic, right? But like, who has that ownership of that? And I have my thoughts on it. I will say, I really think that it is our profession. It's our skill set. We need to own it. We need to be the ones as a hygienist. I want to, love it if the doctor at the office can help pay for some of it, bonus. But it is my career and my skill sets that if it is something that I'm doing, that issue's going to follow me at a different office. So I have to do something and go and seek that information myself.
And I can see both sides. So if I don't feel like my skills are weak, like she said, she's using air, she's checking all her patients, she's disclosing, and the office says, you need to get better and you need to take this course, and then I'm going to expect for them to pay for it. I will tell you that I worked for a doctor who came in, and I was a new grad, and it was like a panic feeling every time he came in, because he would take that air and he would blow, especially on the lower anteriors, on the buckles of the maxillary molars, to check for calculus. And if you saw him pick up an instrument because you left something behind, you better believe he's giving you a real stink eye about it, and he's not happy.
Right.
So because of that developed my skills so much, because I triple checked. My patients would say, wow, you really check everything so thoroughly. But that made me learn how to adapt my instruments better. That made me learn how to use instruments in places I have never used them before. It really made me a good hygienist. So I like that, the doctor is checking. I just want to make sure that the doctor is providing feedback, maybe in a better way than I was getting it, because I also cried all the time because it was really traumatic.
So, like a little bit of extended PTSD of hygiene school going into.
Exactly. But it made me the clinician I am today. And I'm so confident in my removal skills that I don't think I would have got there if I didn't have that push.
Right. Well, and I think that is the other thing too, is that maybe first getting started being overconfident in your capabilities, and then having to take a little humble pie prophy paste to be able to make that happen. Oh, gosh.
Yeah, exactly.
Oh man. Yeah. So I told her, I was like, what my advice was to her, I was like, that's hard, because we are humans and we are always imperfect. So we're never going to be 100% perfect. And I guarantee that any clinician, hygienist, dentist, assistant, you could probably see any of the procedures that they do and put it under a magnifying glass and find a flaw in it. Right. And so being able to practice grace on ourselves and grace for each other, I think, is huge and important. But I did say, I was like, sometimes we have to look at the truth. Like, what is the truth that's in this? Is it possible that I am leaving deposit behind, even when I'm disclosing and blowing air? And I would say, as an instructor, I know that even our eyes will miss it, because I have gone in worked with students and they've like, oh, I've used air, I've disclosed, I've done all the things, and I feel really confident that you're not going to find anything. And I go in and I blow and I disclose, and I'm like, well, you see this here and here and here. And they're like, oh, how did I not see that? And it's just part of it. We
takes time. You train your eye to
train your eyes. You do. And sometimes you just get so focused on the tree, you forget to pull back and look at the entire forest. So yeah, but I was like, you kind of have to look for the nuggets of truth in there and see what part of that can you own and what part is something where you're like, okay, I heard the information, I've learned from it, and I'm moving on.
Exactly. That's a good way to put it.
Yeah. So Kim, final thoughts. What would you have said to that very long explanation? What would you have said if you had to sum it up in 2 sentences? What would you say?
I need more information. I mean, there's 2 sides to every story, and is she coming at it from a bitter point side, or but I would say have a conversation directly with the doctor, ask what they're seeing, ask for them to point it out if they notice it on a patient, and grow through what you're going through.
Yeah, I agree. Couldn't have said it better, Kim. Couldn't have said it better. Thank you for like going with my whim of throwing this obscure listener question right on at you.
I think we're going to have to do this more often.
I agree too. All right, everyone. Tina, and Kim. I'm leaving that in. Tina and Kim saying bye-bye. Thank you to our sponsor, Dental Post, the nation's largest dental job board. Be sure to check them out for different types of employment resources. Also, don't forget to like and subscribe to this podcast. And make sure you follow Tina and Kim on all the different social medias to learn other tips and tricks related to dentistry. Until next time, have a great day.